Assessing hip flexion is pretty straightforward and very simple. You only really need a way to set your camera or your phone up pretty low, close to the ground, so it can get a good side view with an unobstructed view of your hip, and then a nice open area to lay down flat in. So I am going to set myself up with my hip pretty close in line with my camera lens, and I'm going to lay down flat on my back with both legs just straight down. Now, in this position, I have a slight arch in my low back. I can kind of get some fingers under there, okay? What we want to do is monitor that arch as we do this assessment. Or we don't want that arch to change a ton. It can flatten out just a little bit, but we don't want it to really roll back and apply a lot of pressure on our low back, okay? I'll be assessing my left leg, which is my closed leg. And just like the low back, we want to monitor that. And we're also going to monitor the opposite leg. And I'll tell you why as we go. So to assess hip flexion in my left leg, I'm going to start by bringing my knee up towards my chest. And I'm going to slowly start pulling my knee towards my chest. Now, eventually, my pelvis is going to rock backwards and my low back will flatten more. Okay, that's going to be cue number one that we've gone too far. The next cue is going to be, and you probably saw it, this leg. If this leg starts rising up like that, that means that this is tight and it's rocking my pelvis back, and that the front of this hip is also probably tight because it doesn't extend as my pelvis rocked back, okay? But for now, we only care about this hip, okay? We're using this as a guideline to make sure that we're doing it correctly. So first, low back, a little bit of pressure, but it's not going to increase as we go. I'm going to pull my knee towards my chest and then monitor low back pressure as well as this leg lifting. And I think this is my stopping point right here. If I go any further, my back flattens and this leg comes up. So I'm going to come back down. This is my end point. Now, instead of having you try and measure this joint angle, what we can do is measure the distance between your thigh and your bottom rib, okay? So I'm going to use my 4 fingers or 5 fingers, and I'm going to just start right there. Okay, I got that easily. Okay, I got 4, and I am probably just at or maybe just below or just above 3, right? In a perfect world, this thigh will get all the way to your ribs without any extra back flattening or this leg coming up. If you're not sure whether or not you passed this assessment, mark unsure on your assessment sheet. Hold on to the video and feel free to reach out to us. We can help you solve this problem.